Any number of things can impact fertility. First, for the at least 12% of the population is not fertile to begin with, and we know that because people who don't have cancer are seeking infertility care. But it could be the cancer itself, such as the case sometimes with people with Hodgkin's lymphoma, that by the time they're diagnosed, particularly men, they're no longer fertile. It could be a type of surgery that's required. So for example, if you're going to have a complete hysterectomy, you're not likely to be able to carry a child. But primarily it is the chemo or the radiation that you're receiving. And even though we have some techniques, for example, that we can use with young women, we can move the ovaries out of the field of radiation, there could be damage done to the uterus so that it couldn't sustain a pregnancy. And while all of these aspects are important for fertility, there's other impacts to a young person's reproductive system that will have other late-term effects. So, for example, women may go into premature menopause as a result of ovarian failure, which means if you had your chemotherapy when you were 20 and you begin menopause at 25, you then need to be monitored like a 50-year-old woman with cardiac and bone and and other issues that you may face.